everybody, and thank you for coming along this morning. First of all, I'd like to introduce our panel. We have Ben Commons, who's head teacher at Queen's Park Primary and a mental health first aid trainer for teachers. Kelly, who is Wellbeing Associate at Lesness Heath Primary School, and Richard Faulkner, who's head of policy and research at Education Support Partnership. In this half hour, we're going to try and look at sort of mental health, the why, the how, and the so what. Now, that's quite a broad topic that's in the news a lot at the moment, and we only have half an hour. So, first, why? If we look at the teacher statistics, hopefully you're all aware of Ed Support Partnership and the fantastic work they do, and every year they publish a report looking into teacher wellbeing in the UK. And as you can see from the stats, it doesn't make great reading. So, Richard, if I can come to you first, can you just talk us through the figures and the key findings about teacher wellbeing at the moment?
Yes, absolutely. So we do this report annually in partnership with YouGov, and I think the biggest trend we've seen over the last few years has been relating to work-related stress, and we've seen a steady increase over the last 3 years in that. And also teachers and school staff experiencing things such as tearfulness, difficulty concentrating, difficulty sleeping, and irritability. We've seen steady rises across the last 3 years. 2019 was also the first year for over a third of education professionals experienced a mental health issue, and we also saw an increase in terms of staff who had gone to their GP and been formally diagnosed with anxiety, depression, acute stress. Amongst the sort of wider workforce, over 3/4 experienced some sort of behavioural, psychological or physical symptoms as a result of their work. And just to put that into wider context, the CIPR did some work, so CIPD did some work in terms of looking at this across the wider workforce, and they found that 60% experienced these symptoms. So we know that it's disproportionate within education and disproportionate amongst education staff. And the net result of this is for those who experience symptoms, over half said that they would consider leaving education within the past 2 years. And some of the key reasons we saw for that was around the volume of workload, but a new one which has really come to light the last few years has been around the lack of trust and also poor student behaviour. So these are some of the themes we're seeing. And this very much correlates with what we're seeing as a charity in the helplines we run. We've managed over 14,000 cases last year through those helplines, and we're seeing a big increase in not just the number of calls and cases we're dealing with, but also the severity of the cases. So we find that teachers are not getting help at an early stage, but they're waiting till they reach a crisis. And a large part of that is their commitment to the children in the workplace, but we know in the long run it's not having a positive effect. And last year we dealt with an average of 2 callers a day who were clinically assessed to be at risk of suicide by our accredited counsellors. So that shows you the sort of far end of the spectrum that this situation is dealing with. The one thing I should add though is that within the report we saw a lot of good examples where working in school and teaching had a really positive impact on people's mental health and well-being. But obviously the trends we're also seeing are quite alarming and need to be addressed.
So not necessarily a positive start on the sort of teacher workload, but it's not just the teachers that are suffering. The last report that NHS published showed that 12.8% of 5 to 19-year-olds had a mental disorder. So Ben, if I can come to you, are you seeing this reflected in school with the children that you're working with as well?
Yeah. Going back to what Richard said, when I first became a head teacher, I thought it would be about teaching and learning, and it's not. It is, but large parts of my job was taken up with actually looking at people's well-being and what we could do to support their well-being. I would guess that these percentages are an underestimate of what the real figure is, and the reason why I would say that is because there's often misdiagnosis, a fear of discrimination, a lack of understanding, but it's definitely reflected in, I'm across 4 schools, and it's definitely reflected across these 4 schools.
So probably the question is how can we help, and what can we do, and what can we learn from sort of the panel panel that we can put back into practice. So Kelly, can you talk us through the approach that you use at Lessons Heath?
Yeah, as a school, we put well-being at the heart of all we do. It underpins the foundations of everything that we do, and that in turn looks after the learning. So this process starts with releasing the stigma around talking about mental health and giving our stakeholders the understanding and knowledge to be able to explore their needs. Part of that process has been developed through me creating a rigorous identification process, and what that does is we take pupil voice, we capture that data and analyse it and put it in a RAG rating system, so we're able to see our families and children who need much needed preventative support, which includes quality first teaching, early help and specialist supervision. This has had a huge impact on our school community. We not only collect data from our students, we also collect data from our teachers and from our local community and our parents. And what that does, that helps us create a framework that builds strategies and action plans, and we constantly go back and revisit them and ensure that we're keeping up with the changing times and the trends of needs. We have a 4-tiered approach, and what that's done is effectively impact the outcome for our referral systems. All of our CAMS referrals have been accepted in the last year, and we currently have secured 3 EHCP plans for 3 of our children for SEMH needs, and that's because of our identification process and the evidence that we can use to show that we've given quality intervention to all of our pupils.
Thanks. And if I go to Ben, you mentioned something about being across 4 schools. Kelly mentioned the 4-pronged approach. Can you just sort of talk the audience through about how you help the children that you work with across the schools?
Again, going back to what Kelly said and having that 4-pronged approach, we do something very similar because our stakeholders really are our children, our staff, our community and our families. And one of the things we were really passionate about is actually getting an equal footing and a good foundation for children to build upon. When we looked at our staff, how could I possibly ask a staff member to stand in front of a class and give 100% if I wasn't looking after their well-being? We looked within, we looked at structures. I have the lovely Stella over there, who's a cognitive behaviour therapist within our school. But that wasn't the journey that Stella had started on, but it's a journey that she's now developed and grown within the school. So our children, our families, our community have that access to a cognitive behaviour therapist all the time. When we think about the children, we wanted to give the children pathways to happiness. How do we give children pathways to happiness? We wanted to be proactive and not reactive. So again, that brought us back to our structures and what are we doing to be proactive. That brought us onto our mental health first aid, and at the moment we've trained nearly just over 300 people to be mental health first aiders, all of our staff team, because to be proactive we needed to be able to recognise the signs and symptoms within the children so that we could do something about it and signpost them. Our families, our children only spend 50% of their waking time at the school. The other 50% is spent with their families. So what were we doing to support the families? How were we helping them? Because we know if we were sending the children back to an environment that wasn't conducive to their learning, wasn't conducive to their well-being, we were swimming against the tides. So again, we wanted to make sure that we could signpost, we could support, and we could look after the whole family unit. And finally, for us, it was about the community, because as I said earlier about the fear of discrimination and breaking down those stigmas, we needed to do something to actually enlighten people and educate people to it's okay not to be okay. Mental health is fluid, it's on a continuum, and anything in life at any point will affect our mental health. So going back to again, and I know Kelly and I know her well, it's similar approaches that have worked extremely well because what we're trying to do is look at the whole unit, the whole community, put mental health aiders into the community, support the families, support the children, and support, most importantly, our staff. Because I think it's Richard Branson who famously said, if you look after your staff, the rest will follow. And I think there's real power in that actually look after your staff, and you're on to a winning start.
And if we think about the staff, particularly in the press at the moment, mental health and wellbeing is obviously a hot topic, and very often when you talk about teacher wellbeing, you might have seen yoga sessions or being told that director time is to come along for this so you can talk about your wellbeing, when actually as a teacher you might want to just get on with your marking and your planning that you have to do instead of going to a wellbeing session. So Richard, could you talk through kind of how Ed Support Partnership, what you recommend for how teachers and senior leaders can actually support their staff in a meaningful way and not just provide lip service to kind of the mental health and wellbeing umbrella?
Yeah, I think it's an incredibly important point. I think you raised and Ben raised in terms of, unfortunately, there's no silver bullet when it comes to staff mental health. Mental health is complex. It can be a result of an issue going on in someone's personal life as well as their professional life. And again, as Dawn mentioned, there's some really well-meaning senior leaders out there in schools with the best intentions who are putting in place additional activities when actually we know from things like the Teacher Wellbeing Index and from speaking to staff that actually volume of workload is one of the biggest work-related factors which is contributing to stress. So you're almost adding to that. So it's about reducing unnecessary tasks. I think it's about, as Kelly touched on earlier, one of the big pieces of work we're doing as a charity is we've conducted, I think, over 103,000 positive workplace surveys across England over the last 7 years, and they're based around the health and safety executive management standards for stress. And what we see from analysing that data in the early stages is that things like relationships, control over workloads, demands by managers, culture of the school, these are really the key drivers we're seeing are impacting on staff mental health and well-being, and then where I think senior leaders need additional support with them incredibly demanding to be able to focus on going forward. So I think that's really important.
But in a way, and I know this is going to sound a little bit odd, so what? Schools are under a lot of pressure, both with budgets, Ofsted with their deep dives, and having to be aware of lots of subjects. You've got your SATs, the testing regime. So why? So why should schools put mental health and wellbeing at kind of their heart? Why should it matter? Richard, you talked about what schools can do, but why should schools make this a priority? And what does the research tell us? That if schools put mental health and wellbeing at the heart of everything they do, what is the impact and why should they do it?
Well, I think first up, we know a lot around emotional development from a child perspective, but actually we often forget that teaching is an incredibly physically, emotionally, psychologically demanding job. But if you actually look at the support systems which are available to other people, such as social workers or nurses, they've got an awful lot of support around that, and actually that's not really fully acknowledged within education. So I think that's an important first step in just making that very clear. I think in terms of what the research is telling us in terms of the so what, there's been a number of studies recently which sort of look at the link between teacher wellbeing and teacher mental health and things such as pupil wellbeing. There's a really big study in secondary schools by the University of Bristol through the WISE project. If you look that up, it's a really, really interesting study, and they show a really strong association between teacher wellbeing and pupil wellbeing. Professor Jonathan Glassard, who's one of the leading academics in this area, he coins the phrase, if a teacher has poor mental health, it spreads like a virus through the classroom. So again, there is a growing evidence base that's showing the link between these things. And also I think, we look back to things like the Teacher Wellbeing Index. We've got a very disproportionate level of stress. You've got 10 million children and young people spending a large part of their life in quite stressful environments, and that's not going to be good for their learning, their their attainment and their emotional development. So I think these are really important things, you know. And I think also actually just, you know, I think last year there was 2.2 million sick days for teachers, 4,000 off on long-term stress leave, and within the 2.2 million figure, we saw quite a big increase in terms of stress. It's the biggest factor which went up out of all the illnesses. And I think the final thing, just to add, is, you know, we're currently in a recruitment and retention crisis with teachers, and we need to invest in their mental health, their well-being, and encourage them to stay. Because if you look at the stats from, you know, 2011 compared to current day, we're now losing a third of early career teachers inside their first 5 years. So I think, you know, the so what, it's becoming imperative.
Yeah, so the so what, you keep your teachers, you also cut down your lack of teachers, there's sick pay, all of those knock-on costs. Ben, as a head, very often your job comes down to your latest Ofsted report, sadly, your SATs results, so a lot of heads focus on the English, the maths, the year 6. Why have you put mental health and wellbeing at the focus of your 4 schools and not focused on what maybe traditional school leaders might have focused on?
That's a good question. We work in an environment that's rife with accountability, and I would argue that accountability and the stresses that are put upon teachers because of that accountability is counterproductive to getting the best out of your staff team, the best results you could possibly get. When I talk about getting the best results you can possibly get, I'm not just talking about our SATs results. I'm talking about the child's well-being. What do we want for our children? Well, for me, I want a child to leave the school, I want them to be happy, and I want them to have these transferable skills for jobs that currently don't exist. So how do I go about doing that? And what we try to do is we try to create a growth mindset. And our growth mindset was about, if I give you an example, if you put me in a classroom with 30 athletes and you were comparing me against those athletes, I'd feel like a failure. There's no comparison. They're athletes, it's what they do. But if you put me in a classroom with 30 athletes and I was given 100% and the way you spoke to me and your reward mechanism of, you know what, Ben, you've tried really hard and I can see that you've improved. I'm going to have that intrinsic drive and want to constantly improve myself. And that takes a massive shift. I'm not saying these are things you can do straight away. We've been on this journey for nearly 6 years. And talking of results, Dawn, this is the first time we've seen our reception and taken all the way through to year 6. And we're in the top 3% of the country. And my school's in an area where we're in the top percentile for deprivation, we're in the top percentile for free school meals, we have 80% EAL. So this hasn't happened by chance, it's happened because I've got good teachers. But good teachers stay because you value what they do. When that teacher comes to me and says, you know what, Ben, I want to speak to you about something, it's so important, little things, turn away from your computer, face that person and give them your attention. Because that might be the first time they've actually come to you and really opened up and said, can we have a conversation? So simple things such as turning away from your computer and giving staff, pupils, families, the community the time that they deserve. And like I said, we're in a system which is, the accountability and the stakes are really, really high. So we looked at growth mindset. What do we want for these children? How do we get there? We looked within, we looked at structures. We looked at investing in people, and then we looked at pathways. I've said it before, pathways to happiness. So from that was born Westminster Children's University, which Lindsay has taken a lead on. And last year, I was really proud of that. We gave children 33,500 extracurricular hours of activities. Now, that's not necessarily educational hours, that's somewhere to go after school. That means you can spend time with your family for free. This year, I believe, it's nearly 60,000 hours extracurricular on top of what we're already giving. So, and you spoke about recruitment and retention, and we have pretty much zero turnover. Our staff rarely leave. We had one leave this year and we had 88 job applicants. Now there is a recruitment problem, but the reason why that we had such a high number of applicants, I personally believe is because of our open door policy, because I'm willing to sit there and say, right, tell me what's wrong. And don't ask once, ask 3 times. Apparently there's some research around asking the same question 3 times, you're more likely to get the answer that you're looking for. But for that to happen, you've not got to be scared of somebody coming in and saying, why are your results like that? Because actually, they're professionals, they work really hard, and giving them the time and the space, looking at their workloads, to make sure that they can be as productive as they possibly can. Invest in people. Cry with them, laugh with them, enjoy the time with them. There's no one science to this, but it is about actually making sure that I'm looking after Dawn, I'm looking after Kelly, I'm looking after Richard, and they're looking after me. My staff team come in all the time, because this 6-pack isn't by accident, and my staff team come in all the time and they make sure, they say to me, what are you having for lunch? And they make sure it's not a bag of Monster Munch. They make sure that I'm drinking water, they're constantly filling up my water bottle. And I do the same for them. And it really is about making sure that you're there for each other, because yes, teaching and learning is so important. I've had 6 years of trying to drive this through, and I'm happy for you to look at our results. And I do believe that part and parcel of that is because I've managed to keep teachers, we've invested in them, we've invested in the community, families, pupils, so we're trying to level the playing field.
Yeah, thanks, Ben. And I think the results really do speak for themselves, that since they started on the wellbeing track, where they are in the percentage of schools nationally. But as Ben said, schools don't act in isolation. Schools are part of the community, and I think mental health and wellbeing can't just exist in schools. We've got to support our families, and I know Kelly at Letterness, and with you as the Wellbeing Associate, you've set up sort of parent groups, helping support parents. So can you give us a sort of a quick overview that people in the audience might be able to take away of how you've engaged with the wider community?
Like Ben was saying, it's about unlocking potential. Every child and family should have the right to flourish no matter what adversities they've been faced with in their life. So part of my journey at Lesness Heath was the school was in special measures when I was initially invited in. So there was a real breakdown of a positive culture and relationships. So connectivity is the driver behind my wellbeing strategies. So it's about being present and being open and being able to release the shame on some of these situations that these families have been born into, and stopping that repeated cycle of events. So what I did was I created a program called the Family Matters Program, and what that is, it's initially an empowerment program that enables parents to look at themselves as being the product of their environment. So often parents can only bring to the table their own experiences that their own parenting capacities have inflicted on them. So what I do is I give them the understanding and the knowledge and the chance to be the change within their families. This is led and run by the parents. I've had over 50% of our school community engage with this programme with outstanding outcomes. And what that looks like is we've been able to get families off long-term safeguarding plans and keep them off there. They're actually flourishing. One example of that was a family that I was working with where the relationships were completely broken down, and the mum actually was able to identify that she was really struggling to like her own daughter. So I worked systemically within the family. So what that looked like was the mum would come into the Family Matters programme and she would learn about hot topics around mental health, emotional coaching, and then I was working consistently with the child under a play therapy remit. The outcome of that was that recently I attended a roundtable event at Westminster, and both that mother and child were together feeling incredibly proud, and at the end of that meeting they said that that opportunity was life-changing. As educators, we really do have the potential to help families have the best outcomes in life, but what we need to get better at is looking after ourselves. I know as a wellbeing consultant, so often my own wellbeing is placed at the back of the queue whilst I'm serving others a diet of wellbeing. So what I'm really interested in thinking about today is what can we do to safeguard ourselves as professionals to be able to go on and do the incredible job that we do. Wellbeing should be for every day, for everyone. So let's keep that message alive and take that with us on our journey today.
But there is help out there. So on on the screen are several organisations that I use now as a deputy head in schools, and I know that people on the panel. Can I just see a show of hands if you've heard of at least 3 of the organisations on the board? Okay, so now you've got a lot of organisations that kind of you can take away, and we've got 5 minutes left. So it's going to be a bit of a challenge, but I'm going to try and do a whistle-stop 1-minute overview of the charities on the board. And I'm going to start off with the one just above my head, and that's the Charlie Waller Memorial Trust. When I was a deputy head in East London about 6 years ago, there wasn't really much help out there for mental health and wellbeing. Charlie Waller Memorial Trust were amazing. So they run workshops in school, it's a charity, they'll send out brochures that you can give out at parents' evening. So I found it really helpful that if you had parents' evening, I'd have a stall in the hall to talk about mental health, wellbeing, how we can support. They also do a mental health and wellbeing book club. So they'll send a book out to you, review it as a senior leader, share it with your staff, engaging them in their learning. Richard, I'm obviously going to come to you to talk about educated support. Can I just see a show of hands if you're a teacher or an educator in the UK? Can you just put your hand up? Okay. Can you keep your hand up if you've already heard about Ed Support Partnership? 1 minute over to you, Richard.
So as I said at the start, we've been going all various guises for about 140 years. We started off as a Teachers Benevolent Fund, and we now do a lot of work in sort of mental health and wellbeing for staff across England, Wales and across the UK. I think the one thing I'd try and get you to take home is the helpline number. It's staffed by BACP accredited counsellors 24/7, 365. It's 08000 562 561. Anyone working in education can get up to 6 sessions of structured counselling, coaching. There's a range of other services you can get through that from the charity. And we also work in over 800 schools across England and Wales, and there's more information on all the stuff we can do.
Yeah, and am I right, if you go to the website, staff can also download posters that they can put up in staff, because it is a free counselling service 24/7, so it's a really important message to get that out. Kelly, are you going to talk about Anna Freud?
Yeah, the Anna Freud was initially set up by Sigmund Freud's granddaughter, Anna Freud, and it's a fantastic service for anyone working within education. They have lots of different support available. I would highly recommend signing up to their Schools in Mind network, and there you will find lots of animations, lesson plans, which will save time for your teachers. It's a quality space to collect resources and information. They also have other services attached to that, so the On My Mind service has been created to give the voice to young people to have ownership over their support for their own mental health, what they want it to look like and what they want them goals to be. Also within that, you will be able to call them at any time and visit their centre in Islington in London. But there's lots of information, so familiarise yourself with that site and take that information back and share it widely within your school communities.
And also, a lot of the resources on there are also free, lots of toolkits, lots of videos for both engagement with staff and parents. Ben, Heads Together Mentally Healthy Schools?
Yeah, again, I've used all 5 support networks on the board. The Mentally Healthy Schools, one of the things that I found really useful when I was using it was the Headspace and the promotion of Headspace for myself. It made me think about actually what am I doing for myself, how am I taking care of myself, who am I talking to. It gave us strategies to be able to do that. It gave us a network to work within different schools and reach out and share best practice, and it made us really look at our structures, because what was important for me is, are our structures within our school supportive of the 4 prongs I spoke about earlier.
And really important as well is if you're an educator in the UK, US and Canada, the Headspace app is actually free. All you need to do is register with a school address, and again, I could obviously see raised eyebrows, which is great because not many teachers know about it, but again, that's something else to take back and share. Young Minds, another fantastic charity, so they do the Wear Yellow campaign in October for Mental Health Day, and again, have got free resources. So all of these charities that we've mentioned are there to support schools, and hopefully we've signposted them to you. Can I just take this opportunity to thank you very much for coming along to this session this morning. What I will say is, obviously, I'm on Too Simple, we're on stand NG50. We're going to be there afterwards with the whole panel if you've got any questions. We've also got a free Wellbeing pack that you can download with all the links to the charities and some lesson plans to save you time at school. If you could join me in thanking Ben, Kelly and Richard for their time this morning. Thank you once again for coming along, and have a good day at the show. Thank you very much.